Good evening, Pratham. Okay, so I'm Rahul Saha, and in the last class we had completed the muscle thing completely. We had completed the fibers, we had completed the length-tensile relationship, also we had completed the excitation potential, the action potential, how does the ryanodine receptors, the SERCA receptor, they completely bring about the muscle contraction. We had discussed at length the sliding pyramid theory also. So in this class we will be talking about the next part of this chapter, which is the bones, which is how we again locomote. So locomotion is also specifically dependent on bones. So we have two types of skeleton systems. We have the appendicular skeletal systems and we have the skeletal, you can say axial skeleton system. So we have two types. Okay, so appendicular means, you can say appendicular means sideways. All the bones which are sideways means the clavicle, the scapula, okay, or the humerus, ulna, radius, then carpal, the metacarpal, okay, then the hip, pelvic or coxal bone, then the femur, patella, fibula, tibia, okay, metatarsals, phalanges, they all come under the, you can say, appendicular skeletal system. The axial skeleton means the axis, the straight y-axis if we take, that is the axial skeleton, meaning that we have the skull, we have the hyoid bone, we have the auditory ossicles, we have the vertebral column, and we have the thorax, which contains of sternum and ribs. So these specific bones, they form the skeletal or the axial skeletal system. Okay. So here what happens is, I'll get into the detail. Okay, so movements such as throwing ball, you can say biking, walking, require interactions between bones and muscles. Okay, so what happens is the bones, the muscles and joints, they form an integrated system known as the musculoskeletal system. The musculoskeletal system. The branch of medical science again concerned with the prevention or correction of disorders of the musculoskeletal system is known as orthopedics. Okay, ortho means correct. Okay, pedi means child. That is discs correction in child, that is known as orthopedics. Okay, you might have heard of orthopedicians. So orthopedics is the branch of science that deals with the detection and correction of disorders of the or disorders pertaining to the musculoskeletal system. We all know that the adult humans, they contain or they consist of 206 bones. Okay, when we are infant we have almost 320 bones, but they keep on fusing and in the end we have 206 bones. Good evening, Gayatri. So I have begun the skeletal system, the next part of the locomotory system or locomotion. So in our skeletal system, it is a combination of muscles and bone. Okay, so the integrated combination is known as the musculoskeletal system, and the branch of science that deals with the disorders and detection and treatment pertaining to the musculoskeletal system is known as orthopedics. So you might have heard of orthopedicians and all. So the thing is, in an adult body, in an adult human being, we have a set of 206 bones, but in an infant we have about 320 bones that keep on fusing. In the end, what we get is we are left with 206 different bones, okay, which are, you can say, discernible on their own. Just like that, if you count skeletal muscles, okay, for NEET examination, if you count skeletal muscles, there are almost 639 skeletal muscles. That is the number on which you should target, you should tick. But if you count smooth muscles, then the number of muscles will be, you can say, almost infinite, because nobody knows, because smooth muscles are present in the arteries, in the small intestine, in the large intestine. Then you count the cardiac myocytes, okay. Then you have each and every capillary, okay. There the muscle is not there, tunica media is not there, but still it can, you can say, dilate and constrict. But the arterioles, until the artery you have the tunica media layer, means you have smooth muscles. So multiple smooth muscles are produced, and when you gain weight, again you gain the number of arterioles, so you gain the smooth muscles. So 639 is only the number of skeletal muscles, not any smooth muscle is included in that number, okay. So out of the 206 bones, okay, most of which are paired bones with one member of each pair on the right and left side of the body, okay. The thing is, the infants and children have more than 206 bones. Because why? Because some of their bones fuse later in life. Like one example I'll give you is the hip bone. Like sub bones, like specifically the bones known as sacrum and coccyx, okay, of the vertebral column backbone, they fuse later on in life. I'll just show it to you in a few minutes, okay. Then bones of the adult skeleton are grouped into two principal divisions. Number one is the axial skeleton. Say axial skeleton. Number two is the appendicular skeleton. Okay. Axial skeleton and appendicular skeleton. So what happens is, axial means you take the y-axis of the body directly, okay. Again you take the y-axis of the body, okay. So the axial skeleton has a total of 80 bones, okay. Once you start with skull is at the top, okay. Let's count the bones. Let's give you a table where you can count the bones, okay. Axial skeleton, first of all let's put the heading as axial skeleton, okay, and then we start counting the bones. So number one is the skull, okay. Under skull you have something known as cranium, okay, cranium. Now, how many bones are there in the cranium? So, cranium has 8 bones. Okay, 8 bones are there in the cranium. So, if I write here cranium, okay, how many bones? 8 bones. Then, I'll consider face under it also. How many bones are there in the face? 14 bones. Okay. Then if I come on to another one known as hyoid bone, okay, it is also known as tongue bone or lingual bone, okay, is a horseshoe-shaped bone which is situated in the anterior midline, okay, means in the front of the neck between the chin and the thyroid cartilage. That is where the hyoid bone is present. I'll just show it to you, hyoid bone, if you haven't heard of it, okay, hyoid. Hyoid bone location, if I show it to you. So this is the location. Okay. This is where hyoid bone is present. You can see here, this is the hyoid bone. Okay. This one is the hyoid bone. Okay. So what we have is, we have one hyoid bone. It is not paired. We have only one hyoid bone. One bone here. Then we have auditory ossicles. Okay. Auditory ossicles. We have 6 bones here. Now you will ask me about what are auditory ossicles. Okay. So they are present in our, auditory means ear. So auditory ossicles when I'm talking about, okay, are the three smallest bone in the human body. Okay, the malleus, the insus, and the stapes. Okay, these are the three smallest bones in the human body. So they are paired. We have 2 ears, so they are six in number. Okay. Then we have vertebral column. Vertebral column has 26 bones. I'll tell you how later on. Just hold on a minute. Okay, let me make you count the bones first. It has got 26 bones. Okay, and then we have the thorax. Okay, under thorax I can put, you can say, under thorax I can put the sternum. You have one sternum and 24 ribs. Okay. Sternum is equal to 1 and ribs is equal to 24. If you add it up, you get 80 bones. Okay, you get 80 bones if you add all this. Okay, so the sternum is the bone that connects the ribs from the front. That is the sternum. So I'll show you the sternum also. You might have heard the name. So sternum. Sternum bone. It's very common bone. This one is the sternum. Okay, this one. This is the sternum, which connects to the ribs, or which connects the ribs, which is attached to the ribs. You can say that is the sternum bone. Okay. Yeah, you have to learn the number of bones, Gayatri, that is asked in the NEET examination. That's why I'm telling. Number of bones is very important. How many? Like that questions will be asked. How many bones are there in ribs? 24. How many bones are there in your face? 14. How many bones are there in your skull? 8. Plus also the name of the bones you should be knowing for NEET examination. At least the name of the skull bones must be remembered, and types of bones in the ribs. The true ribs, the false ribs, okay, those things you must be knowing for, you can say, comparative examination. They are asked directly. Okay, I'll show you the questions also in the NEET classes. In the worksheet, directly they are shown. Okay, so that is why we should be knowing the names also and number of the bones also. Okay, so then 80 bones here. Now coming on to the appendicular skeleton. Appendicular. So 206 minus 80, how much it is? Okay, 206 minus 80, I think it is 126, right? So 126 must be in the appendicular structure. So once you talk about appendicular skeleton, okay, you start with the pectoral or shoulder girdles. The shoulder blade is the scapula. The collarbone is the clavicle. So you have two clavicle, two shoulder blades, two scapula. Okay. So clavicle, two bones, scapula is the shoulder blade behind one. Okay, two. So I'll just show you both. You can say clavicle and scapula if you haven't heard of it. Okay. Clavicle. This is your clavicle. Okay, this one. You can see, I think this is the clavicle. Okay, this one. And if you see the scapula, okay, this one is the scapula, the behind one. This one, shoulder blade, right? And this is the humerus. Okay, then we have radius ulna in the hand. Radius and ulna I'll also show you. Radius and ulna. Together the hand will be completed. Okay, this is the first bone, radius. Okay, next bone, ulna. This is the humerus. Okay, in the hand. This is the appendicular, means sideways skeleton, not in the y-axis. Okay, so you have something known as clavicle, two scapula, two. Then I can write the upper limbs. Upper limbs with humerus, two humeruses. Okay, humerus, two. Okay, upper limb you can write here. Upper limb, two humerus, then 2 radius, 2 ulna. Okay, see again, radius is this one, ulna is the downward. 2 radius, 2 ulna. Then what else is there? You have carpal, metacarpal and phalanges. Okay, so you have total in the two bones, sorry, in the two hands, you have a total of 16 carpals. Okay, you have metacarpals which are 10, 5 each. Okay, you have phalanges which are 28. I'll just show you the image, it will become very easy. Okay, carpals of hand. Just see this image, it becomes very easy. Carpal, metacarpal, phalanges. Okay, here the triple one. Okay, you can see is the phalanges. Okay, the down one or the which connects to the carpal is the metacarpal. Okay, you can see here phalanges, carpal, metacarpal. Okay, so their number is what I have mentioned, that is carpals is 8 plus 8 16, metacarpal 5 plus 5 10, phalanges 14 plus 14 28. Okay, then we come to the pelvic. You have the hip bone and the pelvic bone or the coxal bone. So there are two bones like that. So that is known as pelvic bone. If I show you, we have two pelvic bones, very easy. Pelvic bone. Okay. Just see, two pelvic bones are there. Okay. This is one pelvic bone, this is another pelvic bone. That's all. So two pelvic bones. So I can write it down here. Pelvic bone equal to 2. Then comes the lower limb. Okay. When you talk about lower limb, you have femur. Femur is the thigh bone, the strongest bone in the human body is femur. Okay, the longest bone also. Two femur bone, we have two thighs, two legs, right? Then we have patella, which is the kneecap. Might be knowing kneecap, patella. You have two knees, so two patella. Okay. Then fibula and tibia, just like radius and ulna. You have patella, two, fibula, two. Then we have something known as tibia, again two. Tibia and fibula, I'll show it to you. Fibula and tibia. Let's see here. Shin bone they are known as. Okay. This is the tibia one. Back one is the, you can say, fibula one. Okay. You have a back one also. Fibula is the thinner one. Tibia is the front shin bone, which is the thicker one. Okay. Then tibia also two. Then we will be having tarsal, metatarsal phalanges. Like we had carpal, metacarpal. It is known as tarsal here. So tarsals are 14. Okay. Only the thing is carpals are 16, tarsals are 14. The rest number will be same. The way, one way to remember. So tarsals 14. Metatarsals are equivalent to metacarpals 10. Phalanges are again equivalent to the phalanges in the upper limb, that is 28. So I'll show that also to you. Okay. Tarsal, metatarsal. So just see here. Very easy to comprehend. Okay. Tarsal bones. You can see here. This one is one view of the tarsal bone. Okay. And if I see tarsal, metatarsal. This is the best way to know. Okay, this one you can see tarsal, metatarsal, then these are the phalanges again. So this is how you can discern the difference between a hand and a leg. Okay, tarsal, metatarsal and phalanges. Again you can look here, tarsal, metatarsal, phalanges. Okay, so one of the tarsal is calcaneus, the down one. This is known as, in common language, what do you call this? You call this a heel, right? The heel bone, right? The heel of the foot, right? And we have this arch in our foot. Okay, this arch is there. So this is known as the bones, and if you just total it up, what you will get is 126. So 126 plus 80 is what you get, 206 bones. Appendicular skeleton has 126, axial skeleton has, or is made up of or comprises of 80 bones. That is the truth, right? I am Rahul Mohammed. So, are you a new student, Mohammed? Pratham, is he a new student? I think he has joined now. I have never seen him. Okay. So, okay. Okay then. This is about the bones, okay? Now I'll just tell you, I'll show you I'll show you all the bones, okay? So, let's get down to the types of bones now. We have various types of bones, okay, that comes in the comparative examination. Types of bones, okay? So you must know the types of bones, at least 2-3 types of bones I'll tell you, which are very important for the comparative examination. One is a flat bone, okay? So flat bones, what are flat bones? Flat bones are generally thin and composed of two nearly parallel plates. They are generally thin and composed of two nearly parallel plates, okay, of compact bone tissue enclosing a layer of, you can say, spongy bone tissue. I'll just show you the image, it will become very clear to you. This is known as flat bone. Okay. If I show you the image, then just see flat bone. Okay. These are your flat bones in the body. Okay, these are all the flat bones. Okay, now you will be thinking about what is compact bone and what is spongy bone that I have written. Okay, that is very easy. So once you have, compact bone is nothing but is dense bone, okay, composed of osteocytes, while spongy bone, and it is mostly, you can say, made up of osteons, I should be saying, whereas spongy bone is mostly made up of trabeculae. Okay, but that is, I have to teach you that, so we leave the spongy and dense here. So just think of flat bone as looking like this, okay, occipital, scapula, hip bone, they are the flat bone. So I think I should be telling more about the simplicity of the flat bones. So flat bones are what? Flat bones can afford considerable protection because it has excessive muscle attachment, okay, extensive muscle attachment. So flat bones, they include cranial bones which protect the brain, the sternum or the breastbone, the ribs which protect the organs in the thorax or the thoracic cavity, and the scapulae also, which are the shoulder blades. Then we have irregular bones. Okay, irregular means they have complex shapes and cannot be grouped into any category. Okay, so such bones include the vertebrae, hip bone. Okay, then we have irregular bone. There is a chapter of bone also which comes in NEET examination. A lot of bone questions are there, but it is not properly given in NCERT. So we'll skip spongy and dense for now. Okay, that's why I'm not going into that detail. So when I'll get the concept class, I'll tell you the specificity of bones. Okay, that are asked in NEET, especially from the bones. Okay, I have Akash worksheet and Ellen. So from there, a lot of bones question have been asked. Okay, regarding the osteocytes, osteoblast, osteoclast. Okay, you might not have read all that, but that is asked in NEET examination. So irregular bones means complex shapes. Okay, just I'll write complex shape. I won't include the dense and spongy category here. So just they have complex shapes. Examples are, if it is asked in the examination, the vertebrae, that is the backbone. Then you have hip bone, then you have certain facial bones. Facial bones, okay. So these are the example, okay. Then we have sesamoid bone, very important question in the comparative examination. Sesamoid bone. Okay. In sesamoid bone, what happens is, sesamoid means it is shaped like a sesame seed. So they develop in certain tendons where there is considerable friction. They develop in certain tendons only, not all tendons. Certain tendons where there is considerable friction. Okay, considerable friction, tension and physical stress, such as the palms and soles. The palms and soles have the highest amount, mostly the soles, the heel bone and all. So there you have the Achilles tendon. So they have the maximum physical stress. Okay, palm, bones and soles, you can say. They contain sesamoid bone. So they vary in number from person to person and are not always the hardest of the bones. They can not always, ossified means they are not always hardest of the bones. Okay, so these three are asked mostly. Okay, so more than that I won't come into the, you can say, in detailing of the bones. Okay, now coming on to the cranial bone. Okay, so cranial bones, you have various types of bones. Okay, but we will again carry it over into the next, you can say, conceptual class, because you have frontal bone. One of the cranial bone is known as frontal bone. Okay, then we have parietal bones. Okay, then we have specific temporal bones, that is there. Then occipital bone is there. So many bones are there. Sphenoid bone is there. Okay, so those things I won't, and then ethmoid bone is there. So there are lots of bones. We won't get into detail of that. Okay, coming on to the facial bone. So facial bone, you must be knowing of, you can say, two things. Nasal bones is there, you know. Lacrimal bones is there. You can say they are the smallest facial bones present on the nasal, lateral to the nasal bones, and form the, you can say, wall of the, or medial wall of each orbit, means over the eye. Okay, so that is there. Then we have palatine bones. Okay, so the names can be asked. One name is specifically asked, and that name is known as vomer. VOMER for facial bone in NEET examination. When we come to facial bone, 14 facial bones. Okay. One name strikes out, that is vomer. Okay, VOMER. So about that I'll tell you. So it is a triangular bone on the floor of the nasal cavity. Okay, the floor of the nasal cavity. Triangular bone, I'll show it to you. Triangular bone on the floor of the nasal cavity. Okay, which attaches or articulates superiorly, means from top with the perpendicular plate of the ethmoid bone and also sphenoid bone. Okay, so vomer, I'll just show it to you. Will be very clear. VOMER, vomer bone. Okay, so you can see the facial bones here. This will be a better way to show it to you. Better image. See here, the frontal bone, parietal bone, backside, sphenoid bone is this one. Okay, temporal bone is this one, nasal bone here, vomer bone is this one. You can see from where your triplet thing is there. You can see this is the vomer bone. Okay, then maxilla, upper jaw, mandible, lower jaw. We can only move the mandible, the lower jaw, maxilla we cannot move, right? So this is all you need to know about the facial bones. You can, if you really want to score 720 out of 720, then better remember all these things. Otherwise, based on your luck, okay, the questions may not be asked, but 720 out of 720 if you want, like Aftab and Anshika, then you must remember the facial bones names also and the cranial bone names also. These are the cranial bones. I'll show you the cranial bones also. Okay, these are the cranial bones. You can see here, frontal bone, sphenoid bone, ethmoid bone, okay, occipital backside, temporal, parietal. Okay, these are the, you can say, cranial bones. 8 cranial bones. You can see 1, 2, 3, 4, 5, 6, 7, 8. Okay, 8 cranial bones. We have the parietal lobe, temporal lobe, occipital lobe. These three bones, easy to remember. You have frontal lobe. Frontal is easy to remember. Okay, left are only sphenoid and ethmoid. Like this you can remember. You have 4 lobes of the cerebrum: frontal lobe, parietal lobe, temporal lobe and occipital lobe. These 4 you can remember, 4 bones. Rest is sphenoid and ethmoid. Moid, sphenoid, ethmoid. That's all. So you can at least remember 8 cranial bones. Okay, like this. Very easy. Okay. Sesamoid seed you have seen, I think, right? Sesamoid. Okay, examples of parts where sesamoid bones develop. Okay, you want that? Okay, I can always give it to you, because I was like just giving you the overview. I was thinking that it may be too much for you. That's why I was giving only the overview so that you just know it. But if you want to know, obviously I can tell you. So sesamoid bone, if you think, okay, have you seen sesame seed? Sesame seed, I'm just saying, like, I think it's known as some sesame seed. I'll just show you. Wait, sesame seed. Sesame seed. Let me show you sesame seed. They look like this. Sesame seed. They look like this. Okay, these bones, they look like this only. The sesame seed, the sesamoid bones. Okay. So if we talk about specifically the sesamoid bones, okay, so they are commonly present in everyone, and functionally sesamoid bones protect tendons from excessive wear and tear. Okay, and they often change the direction of pull of a tendon, which improves the mechanical advantage at a point. That is the work of sesamoid bone, okay, in the person. Protects the tendon from the mechanical tension or pull. So you have multiple sesamoid bones. Okay, so you can say sesamoid bones, the patella or the kneecap is the best example of a sesamoid bone. It looks like a sesame seed only. the patella or kneecap. You have a lot of knee injury, or you might have seen basketball players, football players, they are getting their ligament out of the, you can say, patella tears off. You can say there are multiple ligaments. You have ACL ligament, you have MCL ligament. Okay, so ligaments of knee, if you see, that is a great sports thing. If you have taken, you can say, PED, physical education, then ligaments of knee. Okay, is a great way to know. Okay, you have multiple ligaments. You have anterior cruciate ligament, ACL, then you have posterior cruciate ligament, PCL, you have medial collateral ligament, MCL, and lateral collateral ligament. So rather than giving complex names, I'll just show it to you. It will become again very, very clear. Okay, ligaments of knee, if I type here. Okay, ligaments of knee. I'll show you what is anterior, posterior, everything. Just look here. This one. This is, I think, a better one. See, anterior cruciate ligament, posterior cruciate means front and back. In the front is cruciate ligament. Collateral means towards the side, which holds anti-side. So lateral collateral ligament, okay, meaning that it is towards the away side of the knee, means the side of the knee which is facing the outside of the body. Medial means it is towards the, it is facing the other knee. Means if you see lateral and medial, lateral means away from the body. I'll just show you to you the meaning of lateral and medial. Okay, in medical science, lateral versus medial, then it becomes very, very easy. See here, this way. So this is known as directions of the human body. Okay, lateral is going away. Okay, medial is coming this side. So this side of the knee. Okay, I'll just open this image and make it bigger. Now look, medial means you are coming towards the midpoint. Okay, so medial will be the this point, this side ligament is known as medial. You can say collateral ligament. This side ligament, this is the lateral going this side, it is known as lateral collateral ligament. Okay, proximal means close, distal means far away. Okay, then caudal means down, cranial means towards the cranium, upward. Posterior means backward, posterior is also known as dorsal, anterior is front, anterior is known as ventral. So this is the golden rule of biological anatomy. You should be knowing the meaning of these things. If somebody says what is the anterior view? Anterior view means that is the ventral view, that is the front view you are talking about. Medial to you, if you don't know what is medial, I don't know. It is distal, distal means far away. Proximal convoluted tubule means it is closer to the renal corpuscle. Distal means it is further away or farther away than renal corpuscle, so it is known as distal. Okay, because in between you have loop of Henle, so it is farther away. Just like that, the meaning arises. Okay, so only the muscle part I'll ask. Okay, Pratham, only the muscle part. I won't ask the bone part, only the muscle part. Gayatri and Pratham, I'll only ask the muscle part in the quiz. Okay, and in the subjective test, entire your cardiovascular, okay, and till muscle, only till muscle. Okay, bone I have started now, so I won't be asking, won't be putting burden, only till muscle. Okay, for subjective test, entire cardiovascular plus means blood and heart both, and till muscle, this one. For 15 mark quiz, only muscle, nothing else. Okay, only muscle. Okay, so now coming on to the rib part. Okay, so when we talk about the ribs, okay, the ribs are asked in specific detail in your, you can say, specialized thorax when we talk about. Okay, So the ribs are asked in specific detail in the even in home exam and in NEET exam both. Okay, so there are 12 pairs of ribs. Know it very well. Okay, because more than that is not in your NCERT at all. So we'll conclude in ribs, and next class we will talk about little bit of what is slip disc. You might have heard of slip disc and some injuries. We'll talk and finish this chapter and start the next chapter in the next class only. So the thing is, this is the last part. The ribs is the last part as far as your NCERT syllabus is concerned. So you have 12 pairs of ribs. Okay, 12 pairs. This is given in detail in your NCERT. So I'm going for detailed view. Okay, so 12 pairs of ribs are there. Okay, superior to inferior. Superior means top, inferior means down again. So if I say heart is superior to the liver, means heart is on top of liver. Over liver, heart is present. Liver is inferior to the heart. It doesn't mean that it is inferior organ or it is an inferior organ. It just means it is located downward with respect to the heart. That is the meaning of superior, inferior in biology. Okay, so from superior to inferior, 1 to 12, from top to bottom. Okay, it gives structural support to the sides of the thoracic cavity. We know that the first 7 pairs of ribs are known as true ribs. Why? That is the very basic question. First 7 pairs. Okay, 7 pairs. Out of 12 pairs, the first 7 pairs. First 7 pairs of ribs are known as true ribs. Why? Because they have a direct anterior attachment, means frontal attachment, ventral attachment to the sternum. Okay, via a strip of hyaline cartilage known as costal cartilage. Okay, and also they are attached to the, you can say, vertebrum also. They are attached to the vertebrum also. So they are attached to both the, you can say, directly to the, this is the ribs. So this will be the costal cartilage, you can think of. So they are attached to the sternum via, you can say, costal cartilages. Very important. Okay. So that is, you can say that the ribs that have costal cartilages and attach directly to the sternum, okay, directly to the sternum, are known as true ribs. True ribs are also known by the name in NEET examination vertebrosternal ribs. The scientific name is vertebrosternal. So this is for your NEET examination, vertebrosternal ribs. They may ask vertebrosternal, you may get baffled. What is vertebrosternal? That means nothing but true ribs, just to confuse you, perplex you. Okay. Then you have the remaining 5 pairs of ribs are known as false ribs, because their costal cartilages either attached indirectly to the sternum or do not attach to the sternum at all. Okay. Their costal cartilages, the next 5 pairs, means 8 to 12, 8, 9, 10, 11, 12 are known as false ribs. Because their costal cartilages, okay, are not attached to ribs, either are not attached to, sorry, the sternum, or are, you can say, indirectly attached to the sternum. Attached to the sternum. Okay, meaning that they are known as, you can say, false ribs. Why? Because they are not directly attached via costal cartilage to the sternum. So the cartilages of the 8th, 9th and 10th pair of ribs attach to one another and then to the cartilage of the 7th pair of ribs. So these false ribs are known as vertebrochondral ribs. 8, 9, 10th vertebrochondral. Okay, I'll just show it to you, it will become more clear. 8, 9, 10th, they are false ribs, but they are known as vertebrochondral ribs, indirectly attached. Okay, indirectly means you can say they attach to one another first. Okay, the cartilages attach to one another first of these ribs and then it attaches to the 7th pair of ribs. But the 11th and 12th pair of ribs are completely false ribs. They are designated as vertebral ribs or floating ribs. The 11th and 12th pair are completely false. They are known as floating ribs or vertebral ribs. Okay. Why? The reason is the costal cartilages at their anterior ends do not attach to the sternum at all. It is not indirectly but not directly. They are just hanging. Okay, they are just hanging. It is just not attached to the sternum at all. Okay. Posteriorly, these ribs are attached to the, you can say, thoracic vertebrae, but anteriorly they are not attached. They are like hanging garden. Okay. So maximum rib injuries that you see or that you observe in, you can say, rugby players when they collide or in any car accident, unfortunate accident, is the breakage of the floating rib, the last 11 and 12, because they are not attached to the, even indirectly they are not attached to the, you can say, sternum. They are only attached to the thoracic vertebrae. So I'll just show it to you. Okay, the true rib and false rib. Ribs I'll show you, you will see ribs structure. You can see here. If I open this image, see here. First 7, 1, 2, 3, 4, 5, 6, 7. They are directly attached. Then see. Okay. Then see these last 3. 1, 2, 3. They are attached to the costal cartilage, and this costal cartilage is attached to the 7th one. You can see here. These 3 are attached to the costal cartilage. But this costal cartilage is not attaching directly to the sternum. Directly not to the sternum. But it is attaching to itself to the 7th pair of the rib. Whereas these 7, they are costal cartilages. These are the costal cartilages. They are attaching directly, okay, to the sternum. And these last 2, you can see this one and this one where my cursor is. They are not even attached to this one indirectly. They are just hanging. Only originating from the thoracic vertebrae. They are just hanging, you can see here. They are hanging garden, you can see. So they are most vulnerable to breakage. Okay. This is why. This is the meaning of true ribs and false ribs. Okay. So first, true ribs are known as vertebrosternal because they are attached to vertebra and sternum both. Okay. But false is vertebrochondral because they are not attached to the, you can say, directly to the sternum, but they are attached to the costal cartilage. That's why vertebrochondral, and last one is completely floating. That is the reason of behind their naming again. Okay, so I think, sir, sometimes the person spoken name of heart clean, that those are floating ribs only. Gayatri, those are floating ribs only. The ribs can break and it may penetrate because they are just, they are protecting the heart. So it may have so much pressure that it can go backwards and pierce the heart only. That is true. That you are completely correct about. So now you can write your test, which is about to commence at 8 o'clock. Okay, then so this chapter, only the, you can say, the types of cartilages are remaining. Hyaline cartilage, you can say, and cartilaginous in different cartilages, and fibrous cartilage, elastic cartilage, 3 types of cartilages, and joints. Okay, types of joints are remaining. You have, you can say, fibrous joints, you have cartilaginous joints. Okay, so these joints are remaining to be taught. They are very easy. Just it will take some 20 minutes, okay, for me to teach the joints and types of cartilage, okay. And the most important joint is the synovial joint, okay. Under synovial joint you have various types of joints, those saddle joints and all those things. They come under hinge joints, pivot joints, ball and socket. They come under the synovial only. So I hope you are able to comprehend the lecture. In the next class we'll finish up this chapter. Okay, then thanks a lot. Let's meet you in the